Do you want to talk to your child about drugs and build a stronger relationship? The answer isn't just about talking more, it's about communicating better. Today, we're talking about building communication skills because trust starts with how you talk. Parents and caregivers are the first line of defense. Hi, I'm Aaron, and welcome to Talk Before They Try, brought to you by the Kent County Health Department. Today, we're diving into how you can communicate better with your child. Stick around for more valuable insights from our interview with the child and family therapist from Pinecrest Christian Mental Health Services. As your child grows up, they may forget what you said, but they won't forget how you made them feel. Let's take a moment to think back to when you were 12 or 13. Who did you talk to about your feelings? A parent, friend, a teacher? How did they make you feel? Heard, ignored, or judged? What do they do that made talking easy or hard? Those conversations shaped how you connect today. And right now, you're the one building trust with your child. Why do communication skills matter? Children learn by how we talk and listen. When parents use clear, kind communication, children feel safe to share and are less likely to turn to drugs. Here are three components of building effective communication with your child. Body language, having an open posture and eye contact show you care. Tone, using a calm, warm voice builds trust. And clarity, being specific with your words prevents misunderstandings. Talking to teens can sometimes feel like a minefield. Maybe you've had a conversation go sideways because your tone sounded harsh or your child shut down. Misunderstandings can push children away and make risky behaviors like drug use more likely. The good news, you can improve your communication today. Here are three ways to communicate better with your child. First, use open body language. Face them. Keep arms uncrossed. Facial gestures positive. And make eye contact. Try it during a chat and show you're listening. Also, notice your child's body language and what it's saying. Second, keep your tone calm. Remember, it's not what you say, it's how you say it. That's most important. Even if you're upset, say, I'm worried, let's talk this out in a steady voice. Tone of voice and body language together make up about 93% of the message others get from us. So what we look like and sound like are more important than the actual words. Third, be specific. Instead of saying, clean your room, say, put your clothes in the hamper and make your bed by 5 p.m. Clarity avoids confusion. Try this at home. Have a 5-minute chat with your child about their day. Use open body language, a calm tone, and ask one specific question, like, what's the best part of your day? Reflect back on what they say, like, sounds like you had fun. Here's another conversation starter. I want to hear about your day. What's something cool that happened? Now I've got a question from a parent about communication. My child and I keep misunderstanding each other and it leads to fights. How can I avoid this? Great question. Use open body language, a calm tone, and be specific about what you mean. Summarize what they say to check that you're on the same page. Takes practice, but it works. We're joined again by Matt Shahalki, a substance use disorder therapist from Pinecrest Christian Mental Health Services. He's here to talk about communication skills that parents can teach to their kids. Matt, why are communication skills so important for preventing drug use?
If you don't communicate, what does that tell your child? Do you know? It tells them that you don't care. If you communicate, you are showing that you care. And you don't have to do it the most elegantly. You don't have to do all the exact right things. You don't have to know all the lingo that's out there. You don't have to cuss them out or catch them in the act or pretend that you're above them or anything like that. You just have to not ignore the situation. I think that's the biggest thing.
What's one way parents can improve their body language and their tone when having these difficult conversations?
Talk about this all the time, and it's not easy to do. But be calm. Even if your child says they started smoking or started using, keep calm and match that body language. Even if they say they got drunk, if you're hearing dangerous things that go along with substance use, stay calm. Even if the police bring them home, respond in a calm way. And then you can address the situation with them. And yeah, there might be consequences coming, and there might be some things like that. But you want to portray this sense of calmness. And if your body language is able to match that, then your kid are going to be able to open up with you and trust you and share with you what's going on. Give them a hug. Let them know.
How can parents handle misunderstandings with their child?
Misunderstandings, and how many parents apologize for their behavior before their child apologizes? And why not, though? Like, parents don't often apologize for their behavior, expecting their kids to apologize. But yet, the parents are the mature one, and you're the experienced one. So you should know that if you overreacted, you need to apologize. So try apologizing without waiting. And if you're both in a situation where you're overreacting, try apologizing first and lead by example.
What are some ways that they can avoid these misunderstandings from happening in the first place?
It goes back to that calm that I was talking about. If you're able to keep your body language calm, then your kids will be able to share with you and come to you, and the line of communication will remain open.
What's a practical tip for parents to start communicating better with their child today?
When we behave passively, we're kind of timid, we're not wanting to address situations, we're being really careful. It's like we're afraid of the elephant in the room that we know is there, but we don't want to take it on because we're concerned about what might be. Situations don't get resolved because we don't want to take it on because we're being too passive. Aggressive, just like it sounds, aggressive communication, you get angry, you start yelling, leads to tons of confrontation, that sort of thing. In the middle, there's assertive communication. That's where you want to be for communication with your kids. You stay calm when you're assertive, and you address the issue at hand directly, talk about it. And it's a way of really being respectful both to yourself and to the other people involved, and take care of the concerns related to drugs and alcohol that potentially be occurring, or just addressing future concerns and saying, I know this could potentially be a problem in the future, or you've been hanging out late at night and we need to take care of this, like what's going on, or this party that you went to and I need to know what was happening there because I'm concerned about you. Don't walk away from that. Be assertive about you handling that. If your kids know that you're going to be responsible in handling that, that'll be a good step forward.
Thanks, Matt, for joining us again today. In our next episode, we'll explore parental monitoring and how you can use it to keep your child safe. Join us for the rest of the series. And don't forget to like, subscribe, and leave a comment about a time a conversation with your child went well. What made it work? Please do us a favor. Answer our short survey to help us improve our future videos. The link is found in the description. Thanks for joining us for Talk Before They Try. And remember, parents are the first line of defense.